So we're going to have lots of people that are going to be coming in the next 5 or 10 minutes. So we're going to start with a little bit of homework or a little housekeeping, I guess would be a better way to say that. My name is Valerie VanBooven. I'm a registered nurse and the owner and co-owner of Approved Senior Network. We do lots of different things, but online marketing for the senior care market in general, home care, assisted living, care homes, you name it. That's what we've been doing for 13 years. And we were lucky enough to meet Neil through our senior care industry Netcast that we do every week. And he did an interview with us. And then from there, we started talking about the value of the products and services that he offers. And so I just want all of you to know that when we do these webinars, Neil is our client now. We're helping him with leads and with outreach. But this is not a service that we particularly benefit financially from. And I want you to know that. I think it's important for you to know that I believe in this service and this product. And I really do think that as we move forward, this is something that a lot of seniors and a lot of families and home care agencies like you or wherever you're coming from today are going to benefit from having the knowledge about and investing in and making sure that you can offer this as an additional service. So with that, I am going to turn over the program to Neil Tantingco. I will also say one more thing. We will take questions at the end. I will be monitoring the chat and the Q&A section, but we're going to do questions at the end. We want everybody to be able to get through this presentation, and at the end, we'll take as much time as we need for a Q&A. With that, Neil, take it away.
All right. Well, thanks, Valerie. Hi, everyone. Happy to be presenting again. And I'm so fortunate because I am actually being accompanied by two other fantastic presenters. We have Bob Roth in the call, along with Jean Wang. So, but before I start going through my little diatribe, I'm going to have Bob kick us off first, and then myself will go over next, and then Jean will be last. So, Bob, do you mind kicking us off?
Sure, Neil. Thank you. Thank you for allowing me to kick things off. And Valerie, thank you. I've been a big fan of yours for years, so it's really been a pleasure to get a chance to meet you before we started the webinar here today. And I'm really proud to kick off what I think is an incredible concept. You've got two incredible presenters here. You've got Neil Tantingco, who was presented to you before, and you've got Jean Wang. I've been in home care a long time. Some of you may have seen me present before. I've had the honor of being on the board of directors for the National Association of Home Care and Hospital. I'm on the board of the Association of America. And I will tell you the biggest challenges that we run into.
Hey guys, internet, if you could.
I'm sorry. I got a little feedback there. I do apologize. The three things that we really run into is we run into challenges with what I refer to as the 3 A's. And 3 A's are awareness. A lot of people still don't know home care exists. And people think that home care and home health are one and the same. And then 2, the other piece is the affordability piece. And that's what we're going to talk about today. And then the third one being advocacy. And these guys that are presenting today are going to talk to you about the affordability component and really how we can make home care affordable in the future. And I think there's no better solution than to really pull together innovation and technology and bringing those two together. And these two individuals have extremely incredible company. And I am honored to be here to present them to you today. So Neil, I'm going to kick it back over to you. Neil Tantingco, take it from here. I will come back later on. So thank you so much.
Thanks, Bob. Thanks for kicking it off. So hi, everyone. Again, I'm Neil Tantingco. I'm the founder and CEO of Connected Home Living. So for those of you who aren't familiar with CHL, we're a turnkey telehealth monitoring solution provider, and we design our services specific to agencies like yourself. Right? Our main mission is to keep clients or patients away from the hospital so they can thrive at home longer while they continue the services that you provide. So we do this by blending both technology and around-the-clock remote care coordination. We have an army of what we call remote care coordinators, or RCCs, and they have various roles. But the good news about these RCCs is that they're going to be the extension of your agency, because we know that you can't be there all the time. Now, what we also done is we've also created all these specialized programs. Maybe too long to explain, but the programs range from weekend tuck-in to hospital to home to maybe getting ready for an operation. Anyway, we have all these different programs that's really designed for timely intervention. We're going to help bridge those external social services. But believe it or not, we're also there to provide psychosocial needs, because we know there's a lot of patients out there or clients out there that are becoming more lonely and isolated due to COVID. But the piece that I'm super excited about, which is going to be different from the last presentation that we did, is that we are proudly announcing our partnership with People Power, right? We are going to now integrate behavioral and safety monitoring as part of our telehealth solution. So now we're going to have a 360 view at the patient's home. So now we can monitor, the conditions and the safety of our patients or residents or clients in between the agency or caregiver visits. So we'll go over that in greater detail. But the point of the slide, or the picture down the bottom, is that I know everyone's going to be really excited about the technology, but really in my world, technology is just a way to auto-gather data from the patient or the patient's home, right? But it's what you do with that data that's going to be critical, right? So the second we get, let's say, an alert, right? What is that workflow and protocol? And that's actually an important piece that people mostly disregard, but it's about 15% of the importance of our service. But the meat of CHL is that human connection, right? Because at the end of the day, it's really about, having that human touch, to not just care for the patient, but to have them continue our services moving forward, right? I'll go more in great detail. So just to give you a little bit of background of CHL or myself. So I really started my line of work as an owner operator of an assisted living community in Central California. In fact, to this very day, I still own it. Right? And about 8 years into the business, I started inserting technology really for a lot of different reasons, kind of similar reasons to what you have, the reason why you're participating in this event. I did it for, number one, I wanted to extend the care of my resident, right? Having an empty bed it's no good. No. So I actually wanted to take care of my patients better so I can retain them longer. And so, and I started using technology to capture their vitals, ask questions about their chronic conditions, but more importantly, use that data to start sharing it with the doctor, with the adult children, with the home health nurse that comes in and sees my residents. And sure enough, this collaboration allowed us to interact amongst each other and attend to the patient's matter before things got worse. And the model worked flawlessly, right? So our move out rates went from here down to so, and our community remains fairly full. I think we're right around 94, 95% full. And so, so now we have a waiting list of people wanting to move in. So what happened at the end is that instead of walking away from these people on their waiting list, we started a private duty or in-home care services. So, so as they're waiting to move into my community, we're taking care of them at home. But during this experience, that's when I really saw the strength of telehealth, right? Because when we're there, the patient's fantastic. But once we leave the premises, right, because they can only afford so many hours of care, we found that some of these clients of ours end up going back. So I started blending technology, again, similar to what I did in the assisted living world, but I started doing it in the private duty section. And so I started blending telehealth along with remote care coordination. And sure enough, the same result happened, right? We started intercepting issues before matters got worse related to the patient, and we started seeing less hospitalization, and we started seeing more of our clients staying at home longer, right? So the word got out in the community, and the next thing I knew, private duty companies started calling us, home health agencies started reaching out to us, hospitals started reaching us. So that's when we established our company back in 2015. And now we're in 13 states serving patients, pretty much across the country. Okay. So how does this all work, right? Well, before we go into that, why don't we talk about the challenges, right? So we've been talking to a lot of clients. We've been collaborating with agencies. And as you know, we already have, I shared with you we already have hospital clients. And so I kind of created this slide here to make it a little more concise. So when speaking to clients or adult children, right now more than ever, they are super concerned about their loved ones, especially with COVID-19 and sheltering in place. And a lot of times they can't be with their loved ones because they're too far away, or maybe they're just too busy, right? So it really makes sense to many to provide to hire in-home care agencies or private duty providers to provide the care. But as we all know, the cost for private duty is not exactly cheap, right? Here in California, where I'm based out of, the average private duty care is anywhere from $25 to $35 an hour. And so because of that, they can only afford so many caregiver visits, right? So, just like what I mentioned earlier, right? When your caregivers are there, patient's fantastic and nice and compliant. But once your caregivers leave, right, now you start, whipping out the rosary and start praying. Hopefully the patient is safe by the time you get back, right? So who's going to look after that loved one once that caregiver leaves the premises, right? So you have that concern, but also putting on my agency hat right now, and speaking with other private duty providers, right? Say they're losing clients, right? They're losing clients, a lot of it because of COVID, and it's affecting their bottom line. And a lot of the patients or clients and family members are concerned about caregivers coming in, of fear of being infected, right? And so, especially now, it seems like COVID-19 is purposely engineered to actually terminate our clients. So to make matters worse, there's limited staff, right? In fact, I'm suffering it through it right now. I've got staff who actually prefer to actually do no work because they're happy collecting stimulus checks or unemployment checks. And so I'm actually being hit with limited staff, right? And then also the competition, right? I just opened up the newspaper again. 3 more private duty agencies are opening up. And so, holy smokes, right? I'm really looking for, just like many agencies out there are looking for that genuine competitive edge, right? We're not looking for, stickers or coffee mugs. No, I want something that's going to make that wow factor, right? So that's the other concern. Now, talking to hospitals, since we meet with them quite often, right? So these hospitals, as you may already know, they are trying to prevent those readmissions from happening, right? If you look at the numbers there, out of that 26 billion spent last year, about 17 billion of that could be avoided for readmission. So, and a lot of it are avoidable, right? And the hospitals are basically left with no way to try to address that, because once they leave the hospital, there's really nothing they can do. So they're looking for partners. They're looking for agencies to help them reduce those readmissions, right? But they're not just going to hand out these referrals to anybody, right? They're looking for someone or an agency that really truly has that readmission program that'll prevent their patients from going back. But also too, I recently spoke to one of the medical directors at a local hospital here, just like everywhere in the country, right? They are bracing themselves for this another COVID surge, right? So they are their ERs and IC units are now overutilized. So they're trying to send as much patients directly to the home. Believe it or not, they're actually bypassing skilled and sending them directly to home. And so for those non-emergent patients who require COVID care, they're looking for partners like ourselves, right, who's going to not just deliver that care, but provide that monitoring capability. So that way, we can do something about it before things get worse. Well, guess what, guys, right? These challenges seem a little bit daunting, but hopefully once we're done with this presentation, we're going to deliver the goodies, if you will, that'll help solve these challenges, right? So I put this up real quickly because we're going to wrap this all up in a form of what we call giving a gift of safety, right? So just a little teaser for the end of the event here, but keep in mind, this is what we're going to do at the end and help the clients that we have. All right. So guys, right? The reason why you're all here, you're probably wondering, hey, I've been hearing a lot about telehealth. I'm thinking about telehealth. I'm also thinking about these smart home devices and monitoring systems. I really think this will make a big difference to really improve your quality of service there within your agency. But the question is now what, right? There's so many technologies to pick and choose, right? Where do you even begin, right? And even if you choose the technology, these technologies require major assembly once you get it, right? There's some customization that needs to be done. You got to develop a workflow, right? Make sure it doesn't disrupt your existing operation. You also have to build these, what we call, pathways, right? So, you have to have, a pathway for, let's say, somebody who has congestive heart failure or diabetes or maybe COPD, right? Coming out of the box, these questionnaires don't come readily available. You have to customize that, and that takes a while, right? But even after you put that all together, now you have to figure out who's going to respond to the alerts. Would it be a non-medical or medical people? Are we going to be Monday through Friday only, 8 to 5? Or are we going to be 365 days a year, right? 24/7. So, and then also too, who's going to train the patient? Who's going to set this thing up? Anyway, there's a whole mess of things that obviously you need to do to roll out an effective telehealth and smart home program. And so that's where we're going to come in to help, right? So we here at CHL partner with People Power, right? We're going to deliver this virtual caregiving program that'll provide not just disease management, but also safety and behavioral monitoring, right? But it's low cost, it's highly effective, right? And the beauty about it, it's very complementary to your private duty services, right? It's not designed to replace your people, right? It's actually designed to complement. And I'll go over more in greater detail, okay? So once you're done hearing this, the benefits to your agency, right? By the time everything's done, right, the solution will be out of the box, which means that we're going to provide the platform, we're going to provide the people, we're going to provide the training, right? We're going to provide the support you need to be successful, right? And as I mentioned to you also earlier, this is going to be designed to supplement the commitment hours that you're able to subscribe to a client. So let's just say the client is only able to afford 4 hours a day of 5 days a week of care. Why not bundle our virtual caregiving program along with that? So now for a low cost, the patients now will be getting an around the clock care, right? But it's also a low cost alternative if the patients are not ready or the adult children are not ready yet for any physical care, right? I know I come across that all the time in my assisted living and also my private duty service. They call you, they spend, all this time describing all the horrors about their loved ones, but at the end, they're not ready, right? So why not lead with virtual caregiving to start? It's, again, low cost, highly effective, but based on our experience, we know over time, they will subscribe to physical or live care. And we're going to show you how that happens, okay? The system's also COVID ready, right? The system will help screen potential signs of COVID, but also even if you're confirmed COVID, we have a whole care plan that's already pre-built, and you can use that to not just care for your patients, but also start marketing that. But in addition to that, the system also comes with over 120 care plans for CHF, COPD, diabetes, palliative care. These are things that you don't have to put together because we've already done it for you, right? But once you put it all together, right, the plan is to retain that patient long-term, because that's what we want. We want to hang on to that patient for as long as we can, because they're not just going to love it, right? But we obviously here as a business owner, we want that success as well. And also, this will be a wow factor that I know you're going to admire, because you're not, those days of just, handing out Starbucks coffee or little gift baskets. Now, this is going to be way different from the way you're going to be marketing in the future. And it truly will be a wow factor, because you're going to use this wow factor to go after these referral sources who have these deep problems, right? So now you can position your agency as a key partner, right? You're going to help them with their reduction of readmission. You're going to help them with improving their star ratings. You're going to help them with reducing their patient costs, right? And then the virtual visits, it's now going to be possible, And I'm going to show you how that happens. And again, this offering will allow you to go into these referral sources, and now you have a way to help them resolve some of these overutilized ERs and ICU beds. Okay, all right. So let me go a little bit more into detail about CHL. So once you come on board, right, the first thing's going to happen, your agency is going to be assigned to a live 24/7 remote care coordinating team. You're going to get a staff, right, as part of the service. All right. This RCC has multiple responsibilities. Number one, they're going to be the extension of your agency, right? Because we know you can't be with the patient all the time, but since telehealth is in there, technically we will be, right? But the RCC's job is also to help. They're going to be helping set you up as a telehealth provider, right? They're going to also set up each of these individual patients based on their chronic conditions, based on things that they need to be reminded of or other conditions. But they're also going to train the patient to get them on board. So the net of it, guys, the RCC is going to offload the inherent headaches when you typically start a telehealth program. We're going to offload this off your responsibility because we're going to absorb majority, if not all of that, right? They're going to be available, again, 24/7. They'll provide that timely intervention every time there's an alert. Again, we're going to follow up tasks on your behalf, reminders, help coordinate transport, help them with their socialization because we know a lot of them are super lonely. And anyway, so we'll actually going to show in real life how we're able to do this. So hold that thought for a little bit, okay? But in addition to subscribing to CHL and getting an RCC, we're going to assign the appropriate telehealth platform for the patient, whether they're tech savvy or non-savvy, right? So since majority of believe it or not, a lot of our clients are comfortable using their smartphone or tablet, and if so, right, all we need is their phone number or email address, which will allow us to download the app really easily onto their preferred device. It's effective, it's easy to deploy, and it's also low in cost, right? Now, however, if the patient still wants to use the telehealth on their own, but they don't have a smartphone or a tablet, then we can actually provide them what we call a telehealth kit. The kit comes with its own tablet. We actually also included internet in there, along with a number of medical devices like blood pressure, pulse ox emitter, or a weight scale. We can also add in a thermometer or a glucometer, really retrofit it appropriately based on the patient's needs, right? But it's this model, this kit is actually very effective, right? Obviously very easy to use because it's going to be locked down. You can't do anything other than telehealth. But there is going to be an additional fee, and I'll go over that in greater detail. The other options for the client, we have what we call interactive voice. So if they prefer using their landline or flip phone, we can have an automated voice call into their phone and ask these health-related questions along with prompting of their vitals. And they would just punch in their results onto the keypad. It's easy to use. I usually don't like going down that path, but if need to, right, we can make that available. But the super last resort, if the client is still adamant about not using technology, the worst case we can do is we can just have the RCC manually call or video call the patient, and we'll just ask those questions ourselves, right? And then the RCC will input the data into our system and let us know whether things are within or outside that range of concern, okay? So anyway, probably the best way to describe what we do and how we do it is to actually walk you through an actual demonstration, okay? So I'm going to demonstrate you how the telehealth works using my smartphone. So hopefully you can see this. But anyway, let me paint the scenario real quickly, right? So let's just say I'm an agency, and I learned that the patient lives alone at home, and but needs care. The patient has a history of COPD, some breathing challenges, but also they have a history of UTI. You learn that they're forgetful about their medication, and they occasionally fall. And we also learned that they're lonely, and especially now with shelter in place, the patient doesn't get any visitors. But what we also learned is that the patient's happy using their smartphone because they're always updating their Facebook and so forth. So as an agency, let's pretend I'm able to secure 4 hours a day, 5 days a week of care. Okay. So what we're going to recommend the client is obviously those billable visits, right? In this case, 4 hours a day, 5 days a week. And we're going to bundle in care from Connected Home Living. Okay. So what happens next, guys, I'm going to actually now, I'm going to turn on my phone here. So hopefully you're able to see this. So anyway, so what you're seeing right now is the screen of my phone, right? So what I did as a remote care coordinator, I was able to walk the client through and install the telehealth app on their phone, right? Once it's on their phone, the system will be programmed specifically to that patient based on their illnesses, things that need to be reminded of, and also maybe perhaps, we want to do some survey questions because you're not with the patient all the time, right? So right now, this is the screen, and the screen right now is branded for Connected Home Living. But once you sign up with Connected Home Living, it'll be your logo there up on the top, right? And it'll have all these different functionalities, right? So anyway, I'm not going to go through it in greater detail because of the timing that we have. So let's say I'm going to click on the touch point, right? And these are the things that they need to complete that day. And this could be completed also by their family members or a caregiver on their behalf. So today I'm just going to click on the health survey. Okay.
Did you eat all 3 meals yesterday?
Now keep in mind, I'm going to ask this question when your caregivers are not there, right? So the system is asking again, if we ate my all meals, I'll be a good person, say yes.
How much fluids have you drank in the last 24 hours?
Since we know that this person has a history of UTI, we're going to track their fluid intake. And again, I'll be a good patient. I'll say 1 to 4 cups.
Have you taken all of your medication in the last 24 hours?
You know what? I forgot my medication. I'll say no.
Why did you not take your medicine?
So we're not happy with the word no. So what we've done is we built what we call branch logic. Based on an answer, it'll spider into another sub-question because we want to drill down into the issue. It could be because I ran out of medication and need a refill. Now, every time I click on an answer, behind the scene, I'm associating some level of alert. So since I'm running out of medication in this situation, guess what? We're going to call the private duty company and say, hey, guess what, guys? They're running out of meds. I don't think the adult daughter can pick it up. This will be a chance for you to do more services. Okay?
How much physical activity, exercising, have you done since yesterday?
You know what? Maybe I wasn't able to leave my bed much. Okay?
What has made it difficult to get out of bed?
So again, I'm not happy with that answer. So it could be because I'm in too much pain.
Have you fallen in the last 24 hours?
Okay. I'll just say, no falls.
How often did you urinate in the last 24 hours?
Again, UTI, we want to track that down. Maybe perhaps, I did pretty good, only 2 to 3 times. And just like that, I'm done with my health survey question, right? So now it's time for me to do the COPD because I have COPD, but I'm going to go through that in a different time. But so anyway, so all that data is now being sent to the cloud and onto the remote care coordinator, right? And on his or her screen, she'll see the alerts triggered by the answers that were inputted into the telehealth, right? Now, usually if it's a red alert, right, usually within minutes, the RCC will call the patient. Now, however, if the patient or the client can't wait, they can request for a call anytime, 24/7, and maybe I want to request for a video, and maybe I have some concerns, and I'll just put here,
Video chat.
need assistance.
You've been invited to a video chat by
Well, guess what?
Connected Home Living.
Well, looks like an RCC intercepted the call, so I'm going to go ahead and answer the call here. Oh, hang on here. Hang on. May want to answer that question again. So, hang on. Let me see if I can. Sure enough, when I'm doing the demo, it didn't pop up, right? All right. Hang on. So anyway, once I click on the screen, she'll try again here in a little bit. Hang on here. Oh, there it is.
You've been invited to a video chat by Connected
There you
Home
go.
Living.
So what's going to happen is now launching the video call
Video
platform.
chat by Connected Home Living.
Hey, there she is. There is
Video chat by
Maribel.
Connected Home Living.
Maribel. So thanks for dialing in. So guys, for people here in the audience, right? This is kind of weird because I'm using my laptop through Zoom, video calling, using my phone. So there's going to be a little bit of lag here for natural reasons. So we, you know what, Maribel, do you mind introducing yourself?
Sure. Hi, everyone. My name's Maribel, checking in from Arizona. I'm a remote care coordinator. My main job as a remote care coordinator is to respond to alerts 24/7, extension to the agency and care team. We also socialize with all our lonely patients, provide companionship, and that's just a few things and tasks that we do here at Connected Home Living.
Awesome. So Maribel, I know you've got some cool stories. Could you mind sharing just maybe one story of a client that you have assisted?
Yes, we had a patient, Sam from Utah. She was in a really bad car accident that left her with some brain damage. She lived alone at home. She would over-medicate herself, causing frequent falls, visits to the ER. She was very lonely. She would often forget to eat. We started monitoring her and by video checking in twice a day, making sure that she would take the correct medication. And within 3 months, her family and physicians started seeing improvement. She was very lonely, and she started opening up to us, letting us know that, she didn't feel hungry. She just, she lived at home alone and she didn't feel hungry. So we started having lunch dates with Sam. And so on our breaks, the RCCs would take turns because we all wanted to just have lunch with her. So we would take breaks and have lunch with Sam, make sure she ate. And she really enjoyed that. She would look forward to that. Every day, she was ready with her bubble packs, ready to go, take her medications. And her physician actually wrote us a very, very kind letter letting us know how impressed he was with her improvement and how much, how Sam come a long way. So yes, that was one of our many stories that we have. We have a lot of stories with patients.
That's awesome. Well, thanks, Maribel. I know you're super busy, and we're trying to squeeze more here in the presentations first. So thanks for dialing in.
You're welcome. Bye-bye.
Bye. So just click on the hang up here. So I'm going to go back to the presentation slide, guys. So that's a taste of what we do here at CHL, right? So we do a lot more. But the thing about it, though, so we're happy with the results, right? So like, for instance, we have a client here. She used to average 1 to 2 ER visits a week. She had multiple chronic conditions. She was morbidly obese. And so under our care, similar to the example that Maribel has presented, we started first with video calling, and over time she started answering questions on her phone because she wasn't very comfortable with technology to begin. But over time, at the end, she was able to take vitals and so forth. Anyway, she went from 2 ER visits per week to 2 hospital visits in 6 months. In fact, the hospital was so impressed that they, in the beginning, they thought she had passed away. Right? They called us one day and they said, "Hey, Connected Home Living, is Christy still alive?" And they said, "Yes, she's thriving at home." And so they were just blown away, right? Just to kind of show you a little bit more results of what we do. For instance, we work with a local hospital called El Camino here in the Bay Area. Their readmission rates were between 17 to 25% under patients that are leaving their hospital for CHF, COPD, pneumonia, joint replacements. But by the time we're done with them, with these patients, their readmission rates went down from this rate down to 6.8. And what's more amazing about this too is that we had an 82% adoption rate, which means that these are the patients we have successfully got on board on telehealth, but more importantly, complete their telehealth program, right? It's usually 45 to 60 days. because of the success, we had a minimum of close to $1 million of savings to the hospital. So you can imagine the feeling they got. And because of this, we started getting more referrals. We did the exact same thing with Sutter Memorial here in Central Valley. We took care of their COPD CHF patient. We got it down to 5.2% readmission rate compared to the 25% almost. We had an 80% adoption rate. And again, the cost saving was incredible, right? So we're really happy about the results, but with our readmission, but believe it or not, we're not satisfied, right? Because the telehealth system that we have is fantastic when data is inputted, but we have to wait for that data to be re-inputted, typically later in the afternoon or the day after, right? So a lot of things can happen in between those telehealth visits. And that's why we have elected to work with People Power, because they are filling in that last mile gap that's missing, right? We want to know what's happening inside those four walls. Have they fallen? Have they injured themselves? Are they wandering? Are they, doing things that they should be doing? So after a heavy, long research, and we finally have decided to partner with People Power. And that's why I'm so excited to have them co-present with us here today. So Gene, are you on the call?
Yes, I'm delighted to be here. Thank you so much, Neil, for inviting me. I'm Gene Wang from People Power. I will want to just put in a request, Neil. I too would like to have lunch with Maribel. So hope maybe you can arrange that.
You got it.
People Power was founded in 2009. We have about 50 people. We're really excited about our strong partnership with CHL to offer revenue generating services for care agencies. And our telehome care solution features family care apps, hardware sensors, as well as the family care console, so that people can really understand how their clients are doing without actually going there. Next slide, please.
Okay, moving in.
So just a little bit of background, starting with myself. I am actually a 4-time CEO. I love startups and I have been doing them for a living. I not only have run 4 companies, but I'm very proud of the fact that I'm the band leader of the People Power Band. So we not only work together, we make music together. We're based, headquartered in Palo Alto, California. We work through home care agencies like TheraCare is one of them. We work through service providers such as TracFone to provide wireless Internet of Things services. We're very proud of our affiliation with the National Institutes of Health, and I'll talk about that in a moment. We do have patients in 48 of the 50 states. And we're in particular excited about working with CHL, as you'll see why in a moment. Next slide, please. So a little bit on how we got here. Actually, in 2013, we launched a very popular app that still is widely used because it transforms your old smartphone into a free video camera with built-in motion alerts, which has been #1 top trending app on the App Store about 3 or 4 times. And that's out of 2 million apps. Many people use it for watching over their mom or their grandfather or whoever remotely. So we started there, but in 2018, we were awarded a big grant from NIA to assist family caregivers helping people with dementia. And we really focused our whole company on senior care services to reduce anxiety, reduce depression, and increase well-being. You can see in the charts below that, in fact, the yellow square is the active group. The blue circle does not have our solution. And you can see after 3 months, in fact, we do reduce anxiety and depression and improve well-being. Next slide, please. And so with telehome care, what we're trying to do is make it feel like someone is always helping to watch over your client in two ways: awareness and alerts. So awareness, with our AI software, we can detect, is somebody at home or are people away? If they're away, what time should they be back? What time is it? And I see a pop-up there.
Oh,
How much sleep did they get? Did they take a shower? Did they lock the door? When did the medicine cabinet get access last? But also alerts. Did somebody fall? Did somebody press their emergency button? Did somebody who has dementia wander off? In fact, 3 weeks ago, we caught both a fall as well as somebody with Alzheimer's actually wandered out. And in both cases, our system detected this. And in both cases, the patient was found. Too many bathroom visits. So in addition to being able to, like Neil was demonstrating, just ask the client, but you could also, we can detect actual bathroom visits, sleep quality, medication adherence, and so on. Next slide, please. So this is really kind of an overall picture of our safety and behavior monitoring solution. It starts out with our AI software in the cloud that we have over 200 little microservices seeing things like, is somebody home? Did somebody fall? And so on. We also connect with hardware that, including a personal assist button, otherwise known as an emergency button or a PERS button. We also instrument the house with very low cost, unobtrusive sensors where we can detect motion, we can measure gate speed, we can see if the door opened or not. If the door opens at midnight, that may not be a good thing. We can actually even instrument the refrigerator to catch late night snacking. And we also support directly things like the Apple Watch, the Samsung Watch, the Amazon Alexa, the Google Home, so that we can both track outdoor emergencies as well as voice control. Next slide, please. One of the strong parts of our solution is the intelligent alerts for emergency response, because it's all about surrounding the loved one with people who care about him or her. So we start with contacting using either text or notifications, people who live there, healthcare professionals that are associated with the person. We contact a trusted circle of family, friends, professional caregivers, the RCCs that Neil really has just doing great services, people like Maribel. Thirdly, we can escalate to an emergency call center that is monitored 24/7. This is a 5-diamond medical emergency call center. And then finally, in the worst case, we can dispatch an ambulance or take other measures. Next slide, please. I'm going to quickly go through a few of the services that we support. So you can see on the top of this iPhone, we can actually support security, just like a home security system. But we more importantly give a daily summary of what's going on, a detailed history, and then other services we support are social connectors to remind a trusted circle of family and friends to reach out, to do a good morning wellness check, which is, my mom went to bed at the normal time last night, but maybe she didn't wake up when she normally does. If that goes on too long, send an alert. fall and inactivity detection, as well as other things which are not enabled right here, bathroom monitoring, wandering alerts, and so on. Next slide. The trusted circle is somebody, is a group of, family and friends, can also include professional caregivers, can also include RCCs. And these are people who have different roles and different levels of alerts, and they can be notified if something goes wrong. Next slide. So we do provide a history, a chronological record of what has happened in the home. Here we can see in red a possible fall or inactivity alert. We support a daily report, which is very interesting to browse through. I have a mom who's 84 years old, and I can really see, did she wake up? Did she go out of the house? Did she not return? Did she fall? Did she take her medicine? Things like that. And we measure trends so that we can tell things like, there could be a situation of UTI that the person has been going to the bathroom 11 times or whatever. So we actually make it really easy to stay on top of what's going on in the home 24/7. Next slide. And we also have this family care console where here, and this is something that either your RCC would be using or the home care agency could use. You can see that there are 3 homes or 3 clients in critical condition because they're red. 1 home is in yellow, and then the rest of the homes look like they're doing fine in green. And if we click to the next slide, you can see that we clicked onto the top person, Bonnie's house, and we could see there's a possible fall. Her movement is declining. And also on the right side, you can see that her medicine cabinet battery is low. So somebody should clearly check in on Bonnie. And if you click the screen now, you should get to the video.
Okay. Popping up right now.
Great.
Home sweet home. As parents and grandparents age, living at home safely is a concern for them and their families. Today, because nearly half of all COVID-19 deaths have occurred in long-term care facilities, aging safely at home is on everyone's mind. To fix this, a system is needed to keep track of seniors at home, to know if they've fallen, if they've wandered away, or if they're experiencing difficulties common to people as they age.
If I were to get sick or fall, would anyone know?
What if Mom needs us but couldn't let us know?
My client is alone now. How can we tell if she needs help?
Here's the solution that fixes this. People Power Family Care, a white label telehome care system that enables multiple safety nets to help keep loved ones safe, bringing them and their families valuable peace of mind. The Super Gateway is the heart of the system. This dual SIM edge computing gateway with battery backup is intelligent and stands up to network and power failures like no other. The Family Care mobile app communicates with the gateway and guides users through the simple setup process of first adding a personal assist button to the system. Press the button and in a few seconds, it's connected. It's that easy. It's just as easy to install entry sensors on doors and door frames and motion sensors in a few rooms within the home. With the system now set up, a press of the personal assist button will directly alert the emergency call center, who will then phone a trusted circle of family, friends, and caregivers to check in on Grandma.
Hello, this is Bill speaking. Hello, this is People Power Family calling. We've received a medical alarm. Is everything okay? Yes, everything is okay. Thank you for calling. Okay, thank you. Can I have your name, please? Yes, Bill Taylor. Thank you. Should I disregard the alarm? Yes, please. All right, then. All right, have a nice day.
But what if Grandma doesn't have an emergency response button with her? Or even if she does, she's unable to press it. Because this intelligent system is keeping track of her 24/7. It notices abnormal patterns of inactivity that may indicate a problem. In such a case, the system sends an SMS text alert to the trusted circle who can respond. Or if there's no response, the emergency call center can lead the effort to dispatch assistance right away. What if Grandma falls outside the home or wanders out of the house and becomes lost? That's when our support for the Samsung Galaxy Watch and the Apple Watch comes to the rescue. Grandma can simply triple tap her smartwatch to send an SOS signal. Family Care intercepts this call for help and sends a text alert to her trusted circle who can respond. If there is no response, the emergency call center can lead the effort to dispatch assistance immediately. Family Care's unique software provides layers of safety nets to help keep loved ones safe and bring peace of mind to everyone. In a landmark scientific study funded by the National Institutes of Health, People Power and experts at UC Berkeley are showing that people experience less depression and anxiety and greater well-being when using our system. Family Care's Personal Assist button, together with inconspicuous wireless sensors and smart watches, make it the best and most affordable solution for seniors who want to age safely at home sweet home.
All right, so that gives you a little bit of a taste for what People Power has been working on, and we're really delighted to be working with CHL. Back to you, Neil.
All right. Thank you again, Gene. So now I'm getting a lot of texts, people who I know, they say they're loving what they're seeing. They're excited about potentially getting this going. The question now is, well, okay, Neil, this is great. You know, how do we make money out of this? Obviously, it's obvious that we're going to provide excellent patient care. Also, who's going to set this up? What if the client condition changes? You know, what if the patient is unable to install the sensors on their own? And also, how and where do we sign up, right? So all these great questions to be brought up. So let's talk about the top question first. So because I know we're running out of time, I want to make sure we hit that straight head on. So here, all right. So Gene and Bob, I know we want to tag team together. So you want to kick it off here, Gene? Right.
Sure. Yeah. So one of the great ways to pay for and in fact actually generate significant profits is by bringing in either the wellness and safety monitoring plan, which gives you the assigned RCC, the apps that both Neil and I have shown you, all of those chronic disease pathways, and up to two RCC outreaches per week, along with fall detection, wandering alerts, medical monitoring, and so on. And the monthly cost per patient is $135. If you just mark up your hourly rate by $3 per patient, essentially, and provide a much more comprehensive 24/7 high quality care service to your patients, actually, assuming that you had 15 patients hiring you at 30 hours per week, that would actually bring in additional profits to your agency of $3,825. There's also a second service that is the Safe Harbor and Safety Monitoring Plan. The difference is that it really includes up to 5 RCC outreaches per week, and using similar, or really the same methodology, you can see that would generate monthly profits over 15 patients at 30 hours a week of $28.50. So it's a great way to not only offer a higher quality service, which fits into your workflow, between Neil's company and People Power. We really have this whole on 24/7 tele-home care system that really provides a differentiated service. And you can see that it's not only better for your patients, should keep them engaged with you longer, but it also can generate significant profits.
Awesome. Thank you, Gene. I know, Bob, I know you own your own private duty, and I know you got some feedback about this. Yeah, are there other things that you want to add in on top of this?
I appreciate it, Neil. First of all, Gene, I love how you say telehome care, because everyone thinks of telehealth, and that's really the package that CHL and People Power are bringing here together is telehome care. The biggest frustration we have as home care agency owners is that we get to the point where the person can no longer stay at home. And we hear from the adult child, or we hear from the spouse, or maybe it's a geriatric care manager, that we just no longer have the funding to be able to keep mom or dad or our loved one at home. This is a great solution. It really is. And for me, I look at this as an opportunity to win at the client level, because we're all competing. Peter Ross from Senior Helpers has that great phrase, frenemies. I mean, we really work closely with our home care agency competitors in our market, and we do consider them friends, but we also compete with them for the business. I don't know, Neil, if you have that one slide that I wanted to share how we really broke out the dollars per hour. It's really important for you guys to really understand it. And I'm a big proponent of baking this into the cost. But if you look at the wholesale cost across, and this is the safe harbor plan that Gene was talking about, the $200. So if you take the $200 across 15 clients, that's going to cost you $3,000. All right. And if you wanted just to sell the service to a prospective client and not bake it into the cost, a 75% margin might be a $350 charge, and you can make a profit. That's if you choose to. And you may not choose to. You may just say, hey, you know what? I can extend the life of the client, because that's really where I make the money. I make the money when my client is receiving care from a caregiver. But more importantly, when you talk about baking it in, and again, this Excel spreadsheet that I worked on very closely with Bruce Berglund from Frax, this is a really great tool, because we're looking at adding a premium of $3 an hour for 30 hours. I mean, 30 hours is maybe even below the threshold of your average client with 15 clients. But if we just looked at 15 clients and we baked in $3 an hour over 30 hours a week per client, you're looking at revenue per month of $390, and that's the per month. But if you go over to the other side, per week. Per month is on the right-hand side. So you look over the right-hand side, you're looking at, really establishing under the Safe Harbor plan, you can establish about $5,850 in revenue, offset the $3,000 worth of costs. That's a gross profit of $2,850. That's 95%. So it's an opportunity for you to make some additional dollars, but just for the sake of just demonstrating this here today, Neil, could you just plug in, instead of $3, put in $2? Say you want to bake in just $2. So now you can see you're going to make $900, and it's still a 30%. Guys, the goal is to be able to keep our clients on service. I talked about it early on about the 3 A's. Affordability is the biggest challenge we have. We hate losing clients when they say they can't afford our services anymore. If they're needing live caregiving, caregivers in the home, which we know they are during the awake hours, but during the non-awake hours, if we can envelop them with both CHL and People Power, I think we can keep our clients longer. Guys, I know we're running out of time. I appreciate the opportunity to share this. Please go on to the next slide, and I'll punt it back over to you, Neil. Thank you.
Great. Thanks, Bob. So I know we're running out of time. So I just want to kick this off. So we here at CHL, we when setting up an agency, we require a $1,500 setup, and that's customizing your app, assigning the remote caregiving team. Obviously, making sure that the escalation process is well in place, but also that'll also include the training and helping you market this, because we know at the beginning you're going to need some hand-holding, evangelizing these joint services. So typically the $1,500 is what we normally charge, but for participants of this event, we're going to lower it down to $500, right? And so that's quite a bit of a discount to get you up to speed. I think everyone's going to like that level of reduction of costs. allow you to get this thing up and running quick. So we're going to use this promo code of ASN Safety. So anybody who, if you decide to call CHL or People Power directly, just mention that promo code, and we're gonna know exactly how to apply the discount. So that's it for it, guys. I mean, hopefully everyone here in the call is excited about this. This is actually now raising the bar. The next generation, or the new level, the new gold standard of private duty care is what we're hoping to help you develop. And so, while doing so, you're going to make more money. You're going to have happier patients. And now, as noted in here, you're going to really boldly differentiate yourself from the rest of the competition. So guys, if you have any questions or follow-up, these are our contact information. So I'm going to leave it out here. That's my contact information along with Jean's, and that's our email address and phone number. But I tell you what, I'm going to pass it back now to Valerie, because I know we hit at the top of the hour. But Valerie, do we still have time to answer some questions, or are we ending our presentation?
You do have a question in the chat there.
Okay.
Yeah, we have some questions, and we have one in the chat. We have some in the Q&A. So the first question is, how does this complement Medicare-based patients who we cannot secure hours a day, multiple days a week for care from the agency?
So
complement Medicare-based patients who we cannot secure hours a day, multiple days a week. I guess they obviously Medicare patient who needs more services but can't afford them. So how does this complement that?
Yeah, so this is it is a private paying model, just like with private duty. Telehealth today is not reimbursable yet for the private duty or assisted living communities. It is reimbursable if they are part of an ACO, Accountable Care Organization program. Certain insurance companies do reimburse telehealth. So that one we have to take offline, because there's different ways to approach things. So please give me a call, and we'll go over that in greater detail.
All right. Okay, so this is from Jay. Are your readmission rates risk adjusted, so you are comparing apples to apples?
I'm not sure what you mean by risk adjusted. Yeah, so what we did when we did that readmission, we took the base, right? So before we engaged with the hospital, they actually have real numbers of what their readmission rates are based on specific chronic condition. And that's what we use as our starting point. And then we check back every 6 months and compare our results when patients are under our care. And the results that you saw there on the chart shows a dramatic dip. And because of that dip of reduction, they are not just getting happier patients, but they are saving a lot of money.
All right, next question is, can our logo be added to the watch?
That's a good question. That's a Gene question.
That's a Gene Wang question.
Yeah.
We support 3 watches, the Samsung watch, the Apple watch, and the Care Active watch. And I would say it's unlikely that Samsung or Apple, and especially I think Apple, would never support that. I will say that we are working on this NIA grant I briefly mentioned with a small company that makes the Care Active watch that is able to differentiate between for example, the person with Alzheimer's, the family caregiver and whoever else is in. And it also tracks the indoor location of the person on a second by second basis. We have a very good relationship with this small hardware manufacturer. I would think that they would be delighted to private label that. And in fact, we had the opportunity to put our brand on that. We are not a hardware company ourselves. We just work with hardware companies. So we passed on that opportunity, but with some volume, I think that they would be happy to consider something like that. And please contact me if you're interested in being connected to that company.
Thank you. All right. Next question is, how much training is included if a home care agency signs up?
Yeah, so there's actually two levels of training. So we have as part of our onboard process, there's two separate trainings. One for what we call intake, right? So when we get a brand new patient or a new client, right? So there's a training specific to that. That training is only about an hour and a half. That's not, or maybe less than that. And then then we have a separate track specific to marketing and sales, right? So that one has an initial meeting of about 2 hours, but it's actually ongoing, believe it or not, because especially in the first, let's say 7 meetings, you're probably going to want a security blanket like us to accompany you with let's say the referral source. So for every client that comes on board, we're going to make sure that you install the telehealth app on your phone or your tablet. So this way, when you're doing the questions and answerings on your phone, to show them how easy it is to complete a telehealth care plan, and it'll be myself or somebody within my sales team who will pop up on the screen and help you co-sell it while you're sitting in front of your referral source. Does that make sense? So the training is 1 hour or 2 hours, but then it's ongoing after that because we know we want to be there alongside with you when you're doing the pitch.
At People Power, we also provide home care agency training for installation. On the one hand, we've designed our system to be so simple that anyone can install it. And in fact, we've had probably hundreds of like 70 or 80-year-olds actually install our system. But let me say this, my 84-year-old mother will never be able to install this thing. So one of our several strategies is that we actually will go through a certification process and step-by-step help home care agencies actually install. And this is something that we believe you can charge your clients to do. In other words, they can have the option to have one of their family members or friends install it who's maybe more technical, or they can, maybe pay you $99 and you'll install it for them. It is very, very simple and pretty foolproof, but some people will just never get there. We also do something called a guided virtual installation, kind of like what Neil is saying, where we actually will coach you through step by step that initial setup process, and we are working with Neil's company to train them on how to do that. So there's those several approaches that we use.
Oh, you're on mute, Valerie.
Sorry, trying to keep y'all from hearing the dogs. So the next question is, are we able to put this on our website and social media? And I'd like to answer that. And the answer is absolutely.
Yes.
So for the folks that are our clients who have already have a relationship with Neil and have already started down this road, I will say that we have created their print material and we have put this page on their website. We've done Google pay-per-click campaigns. We put it on social media. So anything marketing wise, if you're our client, we'll happily just do that for you. If it's something that, if you're not our client, then of course you can do it however you like, but certainly for the folks that are with us, we will help you in any way we can to market this effectively. That's just, it's not a charge. It's not something we charge for. So I have a couple more questions for you, and then I think that might be it. So let me pull that up. Hold on a second here. Let's see. Woo-hoo. I have all these things pulled up. I'm looking at your slides here, and one of the questions is, you might have already kind of addressed this, is telehealth reimbursable?
So yes, depending on who you are. If you have, if you're a physician, you're a health system, an accountable care organization, yes, it's reimbursable. Here in 2021, there's legislations that are being proposed, and we're coming close to getting it reimbursed. So stay tuned. So for now, however, it's private pay.
Okay. How much does connected home living service cost the patient and the agency? Yeah,
so we went over that in the slide here. So Hang on here. Hang on. So the monthly cost of the agency is $135 to $200. Some of our agencies are able to mark it up anywhere from again, if you mark it up, if you bundle it as part of your hourly wage, I think if we do the math, you can mark it up anywhere from $75 to $120. I think we do the math. Again, I have to do the math real quickly. So the end user cost would be, right around that range. Right? Okay.
And then what do agency staff need to reach patient?
So from the CHL perspective, there's a couple of ways to do it. Number one, if you want to do it on your own, a portal the authorized contacts within the agency will have access to a portal that'll be white labeled for that agency. Within that portal, you'll be able to render those video calls on your own, but also be able to retrieve all the data that we've captured along with all the notes that we would input. So that's one way, because through the portal, you click on this little video icon, you press the patient's name, and just like that, it rings the patient's phone or tablet or whatever. The other way that we can do it too, let's say the RCC is on the call with a patient and maybe they've discovered something amiss. What they can do is they can invite you, the agency, to join our video call. So they'll send you a link through your phone or your email. When you click on that link on your message, it joins you instantly in the video call. So now all of us are in the same call with the patient live. So we do that all the time when we're doing video triage. Sometimes we invite the doctors, the adult children, anything to not move the patient out of the comfort of their home, so that way they don't get re-hospitalized.
Awesome. And last question is, who customizes the individual telehealth and care plan? I think that's a good question.
Yeah, so that's the goal, that the RCCs who are going to be assigned to the agency. And it's going to be typically the same person that you're going to see every day. We did that by design because we don't want you talking to a pool of people. So anyway, so let's say it's Maribel who's going to be assigned to you. Yeah, her job, as soon as you send that referral form with all the patient data, like their address, contact information of their emergencies, their primary and secondary diagnosis, that's all going to be inputted by the RCC. But also the RCC over time, they will modify that care plan because obviously, like all patients, right, their illnesses change over time. Maybe today they're doing great, but maybe next week they broke a hip. So now we have to readjust that care plan to be, to monitor that pain level, or maybe the incision or whatever, or maybe to develop COVID or a flu. So those modifications are going to be 100% done by the RCC, and that's one less headache that you have to deal with.
Okay, do you have time for 2 more questions?
Sure.
All right. What is shipping for kits? Do you have to purchase a minimum amount of kits? Are there price discounts, or how does that work?
Yeah. So from a telehealth perspective, if the patient does not have a cell phone or a smartphone or a tablet, what we always ask next, does your relative or family have a spare one? Like right now in the back of my living room, I actually have 3 stacks of tablets that are unused, so I can hand that off to anyway, so most families have extra ones. But if they still don't have one, then we do supply the telehealth kit, and there is an additional cost of $125 per month, because in there, we are supplying the tablet, we are supplying the internet connectivity, and all these Bluetooth medical devices. So there is no minimum requirement, and you just order it based on need. In most agencies, they take that cost of $125 and they would mark it up as a margin. On the people power side, yeah. So Gina, I'm not sure if you want to answer that, but actually I can answer that. So when they place the order, let's say through CHL, because we're going to make it really seamless for you. So there is no also minimum requirement of the volume, but we are going to charge for the shipping costs, right? So depending on where they're located, we're going to charge them for the cost for that.
All right.
Yeah, I think the cost of the kit, the basic kit for People Power, is built into this monthly fee.
That's right.
So all there is a shipping cost, and I think it's about $20 per kit.
Mm-hmm.
The other thing is that so the basic kit comes with the small gateway, 1 emergency button, 2 door sensors, and 3 motion sensors. There may be other add-ons that would be interesting to your clients. Other devices that are helpful sometimes are, for example, we have these pressure pads where you can see if they are lying in bed or if they're sitting in their favorite chair. We have additional entry sensors. I mentioned that you might want to put one on the refrigerator, or maybe it's a very large house. In extremely large houses, we can actually string multiple gateways together to provide better coverage. And then we support a bunch of what are called hero devices, which we don't sell ourselves, but we can help get them connected. These include things like the Amazon Alexa, like the Apple Watch, and so on. And those are available in kind of lots of places.
All right. How many calls and how many hours do clients get to talk to the RCC?
So depending on which plan you sign up for, so we have what we call the wellness plan and safe harbor. So wellness plan is up to 2 proactive calls per week. So let's just say you're able to secure 5 days of live visits with the client. So you would probably want to assign the RCC to call during those 2 days that you're not there, right? And that's why we built the wellness plan. Now, however, we built the safe harbor plan in an event that you're able to secure less hours, right? So let's say you're only able to secure 3 days of live visits. So during those 4 other days that you're not there, you would want to instruct the RCC, please call during these times when our agency is not present, and those are the days that we're going to call the patient. The average call typically is anywhere from 9 to 12 minutes because if they're using a smartphone, it's actually, we spend more time just conversing about cool things in life, more social things. But if we're going to have to, ask those questions ourselves about their health, then obviously it's going to take longer. But also too, we actually have volunteers, believe it or not, here at CHL, especially now with the outbreak. We have got a small army of volunteers who are high school, who are mostly high school folks who are college bound, trying to fulfill their community hours. So after they go through CHL University, background check, HIPAA certification, we assign them to their respective patients. And those calls could be, minutes, if not sometimes hours, right? Because they just call them and out of the kindness of their heart. And so, I think that's why we get a lot of people staying with our program, because of the social component of our service.
Kindness of your heart, as well as the fact that we know 1/3 of our population, 65 and older, lives home alone. So loneliness is one of the critical social determinants that we're dealing with. And it's great that they have that.
Christmas is coming. And it's really that last year our volunteers were busy. In fact, since we have video conferencing capability, we can have multiple volunteers calling the same patient. Right? We have one last year. We had a guitar player in Washington, and we had somebody who would sing here in California, but they're talking to a patient in Utah, right? And so it's really cool. They were doing Christmas songs, but they're in 3 different places. Anyway, it's really cool. I wish I would have video recorded the whole thing, but we made a big impact with many.
Yeah, that the last time we did this back in July, you had an example of a college student who would just take his senior with him on walks. He would walk his dog and just talk to his senior while he's walking his dog or doing everyday things, and just hang out with him like a friend is hanging out, and just stay on the FaceTime or whatever it is through the app, and just utilize that time to talk to somebody who doesn't get a lot of phone calls or doesn't get any visitors right now. And I thought that was really nice. So these volunteers are really, I think, critical to that kind of in between visits and phone calls and things like that. It's really nice that these young adults are willing to do this, or anybody for that matter. Even having another senior make volunteer calls would be fabulous.
Yeah.
So yeah, that volunteer pool, we need to grow that fast.
Yeah. No, we have a lot, because right now a lot of the volunteers aren't able to go to assisted living or hospitals or skilled nursing because everyone's banned, right? So now they're volunteering from home. So yeah.
So Neil, Carrie Ryder's asking to see that Excel spreadsheet. Valerie, do we have time to throw that back up there?
Carl, Carl, can you?
I'm sorry, Carl. My eyes aren't.
That's
Sorry,
right.
Carl.
Yeah, go ahead there. There you go.
Yeah. Are you able to see it, Bob?
Yeah, I'm able to see it, and I know we threw the $2 in there just for grins and giggles. Throw in $5. So on a monthly basis, on a monthly basis, you could make almost $7,000 in gross profit. Bruce and I did some surveying, and we were really surprised that some of the people across the country felt that $5 baking it in would be something meaningful. So look, you can go as high as $5. We showed the $2 example. If you throw in $1, you'll see it may even go negative. For grins and giggle, Neil, throw in $1. Yeah, so it does go negative. Expand that.
Oh, Bob froze up on us.
You froze there, Bob.
That's all right. When he comes back, we'll have him talk some more. I got one more question. We'll just keep answering them. All right. What is the average time a client spends on the survey, meaning answering the questions about how much you drank? And what if they have multiple comorbids? Any problem with survey fatigue?
Yeah, you're right. That is one thing that we're very sensitive about. And so what everything, all the questions that you see there are completely customizable, right? And usually in the beginning, we try not to overwhelm the patient and load them up with 30 million questions. And so maybe we'll start off with 2 or 3 questions for the first week, and then ease them into additional questions. Or we can do a blend of questions through the telehealth app, or maybe having the RCCs ask those other half of questions. But anyway, we can make it as little or as many questions as they can stand. So anything to get them engaged, right? That's what we need, and grab the data. Also, too, they don't have to answer it every day, right? So for our patients who are, they're fairly healthy, we're happy if they're fairly healthy. Just doing maybe 1 survey per week would be good, as opposed to somebody who's just getting out of the hospital where they have a high chance of being readmitted back. Those obviously we need to be a little more high touch. So again, it's gonna differ because the patient's condition changes over time, and we're gonna adjust accordingly based on their preference. Right? And Bob, sorry, you locked up and now you're back on again.
Yeah, no, I'm back. Sorry about that. But I mean, if you plug in like $1.55, that's where you'll see almost the break even. So I mean, that's if you bake it in. Just so you know, I think for me, it's much easier sell to really talk about the wraparound, this innovative solution that you have for that family member to keep their loved ones safe. I'm charging a couple dollars more per hour. They don't love, and I'm talking about our clients, they don't love getting charged for this, charged for that. I think it's much easier to bundle it in. So you can go one of 2 ways. You could, try to achieve a 75% margin and get about $350, or you could use this example, and the one we started with was $3, and with $3 you get about a 95% margin. So I'm just glad to give you an opportunity to really look at the economics to this. And again, what I said earlier, we want to keep our patients or our clients, and the biggest challenge we have is when they tell us that they're running out of funds and they've got to go to placement, and we all lose when that happens.
Right.
How many clients are using the platform right now? Or do you have a general knowledge of just hundreds or 100 or 5,000?
Yeah, so under Connected Home on a given day, we see anywhere from 300 to over 450 patients on a daily basis.
Nice.
And I know, Gene, I know your numbers are a little bit different.
Well, I mentioned this app that is still very popular in the world. So we have on the order of 100,000 active users. We've been in business for about 11 years, and we've actually hosted like 1.5 million users over that time. It's not just senior care though. So we're, we have a wide range of Internet of Things services, and we support a wide range of Internet connected devices. So we are a company that manages at scale, and we have also been picked by some of the world's largest service providers. So we're actually pretty proud of our scalability. We also have had 99.999% uptime in 2020. So pretty proud of that.
All right, we're going to take one last question, and that is, what if you set up connected home living with a client and they leave your home care agency and they go to somebody else? What do you do with that?
So the contract will be with the agency, right? Mm-hmm. So when the agency leaves, we leave, right? And so we are, I know that we're a B2B to C company. So our agreement is actually with the agency, and so that's who we're tied to. So
got it. Yeah.
And I would say our answer is the same.
All right, great. All right, this was amazing.
CHL.
Yeah, absolutely. And that makes a lot of sense. So thank you so much for doing this presentation. We will get the replay out to everybody if you want to share it. And this has been super amazing. It just evolves all the time. And I think we need to all look forward to the future where the way we deliver care changes a little bit. There's always going to be a human element, I believe, but there's also going to be an element of all these different technological ways that we can know that someone is safe and doing the right things during the day, the right activities, they're answering the questions, they're on, that you can see their face. But I think bundling that with a human person visiting the house is really a great idea for everybody, especially in an environment we're in right now. So thank you, everyone. Thank you for doing the video, and I'll talk to you guys soon. Thanks for everybody.
Thank you, Valerie.
Thank you.
Thank you, Neil.
Thank you, Bob. Thank you very much, Neil. Talk to y'all later. Bye-bye.
Bye-bye.